Hello everyone, this is Funny. You are watching Funny HS Info. Today I come up with the topic cyanide antidote kit. What is a cyanide antidote kit, what it contains and how to use. This is cyanide poisoning antidote kit, which contains instructions for the treatment of cyanide poisoning, 12 units of amyl nitrile inhalants, 2 numbers of 10 ml ampoules of sodium nitrile injection, 1 unit of 50 ml sodium thiosulfate vial, 3 numbers of 22 gauge needles, 10 ml disposable syringe, 50 ml disposable syringe, 50 ml non-sterile wide nozzle syringe and nasogastric tube. Let us see how to give first aid or treatment by using this cyanide antidote kit. In all cases of cyanide exposure, even if the casualty appears to recover quickly, he or she should be taken to the nearest hospital or facility for assessment and monitoring by a registered medical practitioner. The first aid treatment according to the patient situations. If the patient is conscious and breathing, put the broken tablet of amyl nitrile to patient's nose 5 times at an interval of 15 seconds. If necessary, it's possible to change the tablet with a new one every 5 minutes. It's possible to use 3 or 4 tablets by changing them. In case of swallowing sodium cyanide, it's necessary to induce vomiting in the patient's throat. The use of emetic such as 1% of sodium thiosulfate or soapy water. If the patient is unconscious but breathing, never give anything by mouth to unconscious patient. Put the broken tablet of amyl nitrite to patient nose for 15 seconds and repeat this procedure for 5 times at an interval of 15 seconds. If necessary, it's possible to change the tablet with a new one every 5 minutes. It's possible to use 3 or 4 tablets by changing them. If the patient is not breathing, practice artificial respiration until patient begins to breathe. When patient begins to breathe, the first aid administered should be with amyl nitrite. The medical treatment should be administered by a physician. Put the broken tablet of amyl nitrite to patient's nose for 15 seconds during the preparation for the injection of sodium nitrate and sodium thiosulfate. After the discontinuance of amyl nitrite treatment, 10 cubic centimeters of 3% of sodium nitrate should be given by venous injection to the patients at the rate of 2.5 cc per a minute, and then 50 cubic centimeters of 25% of sodium thiosulfate should be injected at the same rate as above, while monitoring the patients for signs of congestion. The second remedy should be used in a quantity of half as much of first dosage after 2 hours from the start of treatment. However, a dosage of methylene blue is forbidden if the patient has been treated with amyl nitrite.